Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. To which client should the nurse question administering atropine? 1. The 69-year-old client was diagnosed with glaucoma. 2. The 60-year-old client was diagnosed with symptomatic sinus bradycardia. 3. The 55-year-old client was being prepped for an abdominal surgery. 4. The 28-year-old client has severe diarrhea. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on anticholinergics. We will first learn about the actions of this medication, adverse reactions, and contraindications. Anticholinergics are typically used for a number of conditions. Conditions include the following: motion sickness prevention, preoperative secretion reduction and cardiac reflex blockage, and cholinomimetic effects of cholinesterase inhibitors or other medications. Now for benztropine, specifically, a variety of spastic conditions such as acute dystonic reactions, muscle rigidity, Parkinsonism, and extrapyramidal disorders are treated with this medication. Now let's discuss how it works. Acetylcholine and other cholinergic agonists' effects at muscarinic receptors are competitively countered by anticholinergics. Okay, now let's move on and learn about adverse reactions. Blurred vision, constipation, cycloplegia, decreased sweating, headache, mydriasis, palpitations, tachycardia, and urinary hesitancy and retention are common side effects of therapeutic doses. Usually these side effects go away when treatment ends. Hyperthermia, tachycardia, hypertension, increased respirations, dilated, non-reactive pupils, hazy vision, hot, dry, flushed skin, dry mucous membranes, dysphagia, diminished or absent bowel sounds, and urine retention are all indicators of toxicity. Okay, this is important. Let's now learn about contraindications of this medication group. Patients who are hypersensitive to these medications have angle closure glaucoma, renal or gastrointestinal obstructive illness, reflux esophagitis, or myasthenia gravis should not take this medication. Patients with ulcerative colitis, autonomic neuropathy, prostatic hypertrophy, hypertension, hyperthyroidism, open-angle glaucoma, gastrointestinal infection, heart disease, or hiatal hernia with reflux esophagitis should use this medication with caution. There is no demonstrated safe use in pregnant women. Anticholinergics should be avoided by nursing mothers since they may reduce milk supply. Some may even show up in breast milk and be harmful to the unborn child. Safety and efficacy in youngsters have not been shown. Individuals over 40 may be particularly susceptible to these medications. Use with caution and administer a lower dosage as directed for elderly patients. Okay, so now that we have a good idea about how this class of medication works, let's now focus on the commonly used medications of this class, starting with atropine sulfate. Atropine sulfate is used to treat symptomatic bradycardia and bradyarrhythmia. It also is used as an antidote for anticholinesterase insecticide poisoning. Another use of this medication is that it can be used preoperatively to diminish secretions and block cardiac vagal reflexes. And lastly, this medication can be used as an adjunct treatment of peptic ulcer disease, functional GI disorders such as irritable bowel syndrome, salivation and bronchial secretion reduction, CNS conditions such as Parkinsonism, ureteral and biliary colic. So atropine sulfate is a medication that is used for a number of conditions. The way this medication works specifically is that it inhibits acetylcholine at parasympathetic neuroeffector junctions, blocking vagal effects on SA and AV nodes, enhancing conduction through the AV node, and increasing heart rate. Side effects are the following. With the central nervous system, side effects are headache, restlessness, insomnia, dizziness. With the cardiovascular system, side effects are bradycardia, palpitations, tachycardia. ENT side effects are blurred vision, mydriasis, photophobia, cycloplegia, increased intraocular pressure. The gastrointestinal side effects are dry mouth, constipation, thirst, nausea, vomiting. The genitourinary side effects are urine retention. Other side effects are anaphylaxis. Okay, excellent. Now let's learn about nursing actions for this medication. Adults should not take doses below 0.5 milligrams due to the possibility of paradoxical bradycardia. Keep an eye on your urine production and fluid consumption. With nursing actions comes patient education. Here are some points to teach the patient. Instruct the patient taking the medication orally on how to manage uncomfortable anticholinergic side effects, including dry mouth. Tell the patient to report any severe or ongoing side effects as soon as possible. Inform the patient of the possibility of sun-induced eye irritation and recommend sunglasses. Benztropine mesylate. Benztropine mesylate is used to treat drug-induced extrapyramidal disorders except tardive dyskinesia, transient extrapyramidal disorders, acute dystonic reaction, and Parkinsonism. The way this medication works specifically is that it may block central cholinergic receptors, helping to balance cholinergic activity in the basal ganglia. Side effects are the following. With the central nervous system, side effects are confusion, memory impairment, nervousness, and depression. With the cardiovascular system, side effects are tachycardia. ENT side effects are dilated pupils and blurred vision. With the gastrointestinal system, side effects include dry mouth, constipation, nausea, vomiting, and paralytic ileus. The genitourinary side effects are urine retention and dysuria. Musculoskeletal side effects are muscle weakness, and other side effects include decreased sweating. Okay, excellent. Now let's learn about nursing actions for this medication. Depending on the patient's response, medications might be administered either before or after meals. Give the medication after a meal if the patient has a tendency to salivate excessively. Give the medication before meals if his mouth dries up too much, unless it makes the patient sick. Monitor vital signs and watch for negative effects, particularly in elderly or bedridden patients. With nursing actions comes patient education. Here are some points to teach the patient. Advise patients to refrain from attentive activities until the drug's central nervous system effects are recognized. Instruct the patient to take their medication at bedtime if they only take 1 dose per day. Urge the patient to report any indications of urine retention. Advise the patient to use hard candies, sugar-free gum, ice chips, or cool liquids to ease dry mouth. Encourage the patient to restrict their exposure to hot conditions because drugs can prevent them from perspiring, which can lead to hyperthermia. Dicyclomine hydrochloride is used to treat irritable bowel syndrome and other functional GI disorders. In particular, this drug reduces GI motility by blocking acetylcholine's effect on parasympathetic postganglionic muscarinic receptors. Spasmolysis may be partially caused by the drug's local anesthetic qualities. The following are examples of side effects. Headache and lightheadedness are adverse effects of the central nervous system. Tachycardia and palpitations are cardiovascular adverse effects. Mydriasis, elevated intraocular pressure, and impaired vision are among adverse outcomes of ENT. Constipation, dry mouth, thirst, nausea, and vomiting are all considered gastrointestinal side effects. Impotence and urine difficulty or retention are the genitourinary adverse effects. Urticaria, reduced or absent perspiration, and local irritation are skin side effects. Allergy reactions are additional adverse effects. Okay, excellent. Now let's learn about nursing actions for this medication. Antacids may hinder the absorption of dicyclomine. Dicyclomine should be given at least an hour before antacid. Give the medication 30 to 60 minutes before bed and before meals. Give a bigger dose at bedtime, at least 2 hours after your last meal of the day. Monitor the patient's vital signs and urine output. With nursing actions comes patient education. Here are some points to teach the patient. Encourage the patient to stay away from driving if they experience fatigue, lightheadedness, or blurred vision, to stay hydrated in order to avoid constipation, and to report any skin rashes. Let's go back to that question we had in the beginning of the video. To which client should the nurse question administering atropine? 1. The 69-year-old client was diagnosed with glaucoma. 2. The 60-year-old client was diagnosed with symptomatic sinus bradycardia. 3. The 55-year-old client was being prepped for an abdominal surgery. 4. The 28-year-old client has severe diarrhea. The correct answer is 1. Atropine, a muscarinic agent, is contraindicated in a client with glaucoma because atropine causes mydriasis and paralysis of the ciliary muscle, which would increase intraocular pressure and may cause blindness. Did you get it correct? All right, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.